Hi, my name is Isabella, and my passion is pediatric nursing. So, what is a pediatric nurse? They are registered nurses that care for children from birth to the age of 18. They are seen in a variety of areas in the healthcare field, including hospitals, rehab facilities, and outpatient services. They not only evaluate and monitor the patient as their role, but they also provide treatment and medication administration. They are also able to comfort the patient if it was an emotional or stressful situation. They are also able to provide education to the pediatric patient to an age that they would understand in their developmental age, as well as the parents and or guardian. Why I love peds. I have always had a love and interest for the human body, and I actually really enjoyed going to the hospital when I was younger. I've had many opportunities over the years of working with children, from babysitting to camp counseling to my current job right now at a family practice. I have always just had good relationships and developed great relationships with kids over the years, whether it be short term or long term. And I just really love making them laugh and smile and talking to them and just having great conversations overall. I do know it is a stressful and scary time when they're in the hospital or even going to the doctor's office. So I want to be that person for them that is able to comfort them throughout their stay. And I also know it can be difficult for the parents as well. And I do love building relationships with them as well and easing some of that stress off for them because it can be a very difficult time. Just a couple of stories that I've experienced over the years related to pediatrics and healthcare. We did have a kid one time that was hypoglycemic and passed out. We also had a kid that actually had an arrow go through their hand because they were playing with the bow during archery. And I was one of the first people on the scene before EMS was called, so it was a little scary. I am also really good and flexible at balancing many kids of different ages, from about 12 to 15 kids, ranging from babies to fifth graders all the way to high schoolers. I'm very flexible. And when I go to the doctor's office, when I work there, I just really enjoy making the kids smile because I know it can be very scary when they possibly think they're going to get an injection or something. So I'm always just there to make them laugh a little bit, just because you don't want to have a bad experience. So, some requirements to be a pediatric nurse: you have to be a registered nurse, preferably with a bachelor's degree. It is optional to have a pediatric certification. That pediatric certification, you can do it two different ways: the PNCB or the ANCC. One is through the Pediatric Nursing Certification Board. To be able to apply, you need about 1,800 clinical hours of pediatric nursing in about 24 months. Or you can have 5 years of experience as an RN, and about 3,000 of those clinical hours need to be pediatric based. To apply for the American Nurses Credentialing Center, you need about 2,000 clinical hours or direct clinical supervision experience and 30 hours of continuing education for nurses in the last 3 years. From there, you would then take your exam and be certified. This is just a little collage of what I think a pediatric nurse is. They do see every single age group from newborns, babies, all the way to adolescents and teens. They are considered superheroes, and also they collaborate too with the parents as well because the care involves someone taking care of the pediatric patient. I do want to work in any pediatric field. Honestly, I'm open to all of them. And not only is pediatric a specialized area, but there are many opportunities within that area, such as the ones listed on here. We have dialysis, neurology, oncology, diabetes, even camp nurse. And it's just really cool to see all the opportunities that you can have within that specialized area. My timeline within the next few years: I hope to graduate in May and take my NCLEX shortly after. Depending on what I want to do, one area I may do is get my bachelor's and start in this coming fall, and then continue to work part-time at my uh, family practice while getting my bachelor's. Or I would then start working immediately after with my registered nursing license, and then maybe wait about a year or so to go back to school and get my bachelor's. And hopefully, in about a year or two, I will have my bachelor's degree as well, start my job and my passion in the pediatric field. And then, years and years down the line, I would really love to be a school nurse and just continue to grow and learn new skills. Hi, my name is Isabella and I want to be a future pediatric nurse. So come and join me in a day in my life at what I normally do at my job. Allie? Alright, I'm going to get your height and your weight before we get you back in your room. Can you take off your shoes for me, please?
Yes, ma'am.
Alright. And hop up on, feet together, kind of come a little forward. Good job. Okay, perfect. And we're going to come right around here and have your back against the wall, feet together, push your feet all the way to the wall. Good job. I'm going to go right this way. Perfect. Alright, perfect. Hi guys, my name's Isabella. I'm going to be checking you in today. So what's going on?
She's just been complaining that she's been feeling not good.
Okay. So what's going on? What's hurting you?
Like my belly hurts and my ear hurts.
Your belly hurts and your ear hurts? Okay. Can I get your finger? I'm going to check and see what's going on. When your belly hurts, is it feeling like, someone's like punching you almost? Or, yeah? Okay. All right. And then I did see we have no allergies to any medications or anything. How long have your ears been hurting, would you say?
Probably like 10 days.
10 days? Okay, okay. Well, we'll get the doctor to come in and check on you and see what's going on, okay? All right, so I'm going to get your blood pressure. Have you ever gotten this done before?
Mm-hmm.
It's basically like a little squeeze on your arm, almost like a hug. So let me roll up your sleeve here. Okay, good job. And get your hair out of the way, I don't want you. All right, I'm gonna listen here and see how good your heart's doing. Okay, and relax your arm, kind of like a noodle. There you go, good job. And little squeeze. Good, good, good. Good job. All right, so I'm gonna give you your flu shot, okay?
But I don't want to.
That's okay. It's gonna be a quick little stick, and then how about we get you a toy afterwards, maybe, and a sticker? Okay, so it's okay. You don't have to look. I'm gonna do this shoulder right, this arm right here, because I know you said you use your other arm more, right? Yeah, okay. So I want you to do is look at mom, go that way. Good job. And then feel a quick, cool little thing. Perfect. All right. And it's going to be a little stick, okay?
Mm-hmm.
And 1, 2, stick. All right. Good job. See, was that so bad?
No.
No, that was good. Good job. All right, so I'm just going to listen to your lungs and your heart, okay? All right. All right, so take some big, deep breaths for me. Good job. Another one. Good job. Another one. Good job. And I'm going to listen to your heart right here. Good job. Good job. My name's Isabella, and I want to be a pediatric nurse. High five. High fives. Yeah. Woo! Yeah! And my last video is just a little snippet of what I want to do and hopefully will relate to whenever I become a pediatric nurse in the future. I'm a pediatric nurse. Of course I know everything about Disney. I'm a pediatric nurse. Of course I have all the best stickers for you. I'm a pediatric nurse. Of course I wear superhero scrubs. I'm a pediatric nurse. Of course I have all the best toys for you. And this is just a little thing I found of what people think you do when you're a pediatric nurse and what you actually do, which is provide care to the most amazing group of kids. And that is all. Thank you very much, and thank you for listening.